I'm Dr. Nadeem Sajjad Raja. You are watching my YouTube channel, Dr. Raja Nadeem Sajjad Official. This video is about cholera. Cholera or acute diarrhea, acute gastroenteritis. This video is especially for those travelers who are traveling to the area where cholera is common or people who are living in cholera area. Cholera is a bacterial infection which is caused by Vibrio cholerae, and presentation is acute diarrheal illness. It is a global threat and public health issue. Wherever cholera is common, it is an indicator of inequality of that area in the society and lack of social development in that area. According to World Health Organization, 1.3 to 4 million cases are reported every year and 21,000 to 143,000 deaths occur every year. It is a severe infection. It is emergency. Whenever anyone ingests Vibrio cholerae either by drinking contaminated water or contaminated food, 12 hours to 5 days, they show signs and symptoms of cholera. Cholera affects all ages, male, female. Children are particularly at risk because they go outside, they play in the water, sometimes they swim in the water, they ingest Vibrio cholerae, or they are not aware of hygiene, so they drink contaminated water or contaminated food. It is very easy to treat. Cholera kills patient within an hour if untreated. Many patients are asymptomatic. After being infected with cholera, they keep shedding Vibrio cholerae in their feces between 1 to 10 days. Patients with mild symptoms or mild diarrhea, they recover within a few days, maybe 3 to 6 days. Some patients experience severe symptoms and prolonged diarrhea. Excessive fluid loss and dehydration is very important sign and symptom of cholera. If dehydration is not corrected, then patient might go into the shock. Initially, there is a painless diarrhea and vomiting. In more severe cases, there is a loss of electrolytes. For example, loss of sodium, chloride, potassium. There is an intense thirst because of dehydration, decreased urine output, muscle cramps. Patient feels very tired, weak. Severe symptoms are noted in patients with blood group O. Patients with blood group AB, they experience less severe form of cholera. Cholera is very common in India, Middle East, Asia, Africa, South America. However, outbreaks are reported during warm weathers in those areas. There are also epidemics in Europe, Australia, and other Western world. Cholera is always diagnosed on the basis of clinical picture because there is a rice watery stool and profuse diarrhea and maybe 20 times or more in a day, in a short period of time. So whenever there is a rice watery stool, profuse diarrhea, then cholera is always on the cards. Stool samples are also sent to the microbiology lab for hanging drop as well as culture. So after the culture, it is the confirmation of cholera infection. Treatment is very important, especially rehydration. So uncomplicated cases resolve within 3 to 6 days and person is free from Vibrio cholerae within a 2 weeks time. Majority of the patient require fluid replacement due to prolonged, profuse, rapid diarrhea. If fluids are given early, then prognosis is very good, and then patient can go on oral rehydration, salt and other fluids. Main aim is to restore electrolytes, sodium, chloride, potassium, etc. Antibiotics are also given to shorten the duration of illness. Doxycycline is the drug of choice. Amoxicillin is an wise or alternate to doxycycline in pregnant women and children. Furazolidone is also given. It is very important to prevent the diarrhea, prevent the morbidity and mortality. If you are traveling to cholera area, or if you are living in that area where cholera is common, wash hands frequently, especially after visiting toilet, preparing food, before eating food. Always drink clean water. It is the responsibility of the country or government of that area provide clean water to their citizens, adequate sewage disposal. Wherever clean water is not available, use boiled water or bottled water. Avoid eating uncooked vegetables. Do not use or eat ice. If you are traveling to cholera endemic area, please consult with your doctor. Ask about the vaccine. Oral cholera vaccine or Vaxchora is available. This vaccine provides good protection, but there is no 100% protection. So preventive measures are no doubt very important. Booster dose is required after every six months. World Health Organization has approved 3 other oral inactivated or non-live cholera vaccine. If you have any question regarding cholera, or if you are traveling to that area, please write down in the comment section and I will answer your queries. If you haven't subscribed my channel Dr Raja Nadeem Sajjad official, please do so and press bell icon button. Thank you very much.